Swollen feet during pregnancy is a very common condition that a lot of mothers experience. So, what is the reason for swollen feet? And how do you manage swollen feet during pregnancy? This is what we will be discussing in today's video. Hi, I am Saranya, the founder of Babypedia and a birth professional. I am also a life coach for pregnant women. In today's video, let us discuss about why do pregnant mothers get swollen feet and remedies on managing swollen feet during pregnancy. There are multiple reasons for getting swollen feet during pregnancy. The first one is because of the hormonal changes. During pregnancy, our body releases a hormone called relaxin, which relaxes all the muscles, ligaments that are there in our body. That could also loosen all the ligaments that is there in our feet. Number two, our body holds on to water during pregnancy. So because of water retention, it could lead to swollen feet as well. Number three, lot of times because there's a lot of pressure on the lower part of our body, our uterus is pressing on the nerves, on the blood vessels that are carrying blood, and there is lesser circulation. It could lead to swollen feet. These are just some of the known reasons for swollen feet. There could be others also. So now, but before I jump into remedies for swollen feet, swollen hands are normal during pregnancy if it is gradual. But all of a sudden, one fine day, you find yourself having sudden swollen hands, feet, face, a lot of swelling. It is an indicator that you have to rush to your doctor because this could be a sign of preeclampsia, which is a little complicated during pregnancy. If you have just normal little bit of swelling on your feet and hands, then watch the rest of the video for 13 different home remedies. So the first one would be ensure that you are hydrated enough. Yes, sounds ironical. Your body is already holding on to a lot of water. So if you drink more water, won't there be more swelling? No, your body needs a lot of water to flush out all the toxins that it is holding and to improve circulation in your body. So that is why when you drink more water, ideally 10 to 12 tumblers of glasses of water a day, it helps to manage the swelling in your feet and arms during pregnancy. The second one, change your position often. If you are having a desk job and you're sitting for long, then ensure that you take breaks every 30 minutes, walk around, stretch your feet, drink some water, and then come back and continue your work. Sit in a proper position where your back is straight, your feet are not hanging, but it is placed firmly on the ground. If your chair is a little high, get a footstool and place it under your feet and place your feet flat onto the footstool or the ground to ensure that there's proper blood circulation. If you are somebody who stands a lot in your work, take breaks, sit for a couple of minutes, and again stretch your feet, drink water, and then get back to your feet. Number three, wear comfortable shoes. During pregnancy, it is known that your feet may increase in one size. This can lead to very ill-fitting shoes, tight shoes. Also, do not wear anything that has heels in it. All this will cause a lot of pressure to all the ligaments and muscles in your feet, causing it to swell. So always wear comfortable flat shoes. If your feet have grown, then please go buy new shoes that are one size bigger or whichever is comfortable for you. Next, reduce your salt intake. Excess sodium will cause water to stay back in your body, leading to water retention and swelling. So you need sodium. So don't totally go on a no sodium diet. Balance the amount of sodium that you are taking. Shouldn't be too low, it shouldn't be too high, just moderate to taste in some foods, and in some foods you can go bland without the salt. The next thing, just like I told you to reduce your sodium intake, the next tip is increase the potassium intake. Take potassium rich food like bananas, tender coconut water, seeds, curd, yogurt, etc. in your diet because potassium will help balance the water levels in your body. Next, reduce the amount of caffeine that you are taking. Though research tells us that a certain amount of caffeine, 2 to 3 cups of coffee is okay in a day during pregnancy, caffeine acts as a diuretic, meaning that it will cause you to push out all the water that is there. It will cause you to urinate and it will ensure that your cells are not holding on to water. When your body feels that there is less water, then it will fight to hold on to the little water that is there, causing your body to swell. So reduce the amount of caffeine that you are taking. The next tip is stretch your feet and exercise for a minimum of 30 minutes every day. Stretching your feet, a bit of ankle rotation, walking, exercising are all known to help manage the water levels in your body, ensuring that you do not get swollen feet and cause you a lot of discomfort. Next, you could also ask your partner to massage your feet every day before you go to bed, because it will let you sleep much better, reduce the amount of swelling that you have by stimulating the circulation of water and blood in your feet, reducing swelling thereby. You could also soak your feet in cold water or warm water mixed with Epsom salt, that's magnesium sulfate crystals, and this will remove the excess salt and water in your legs, improve blood circulation in your feet, and reduce swelling. The next tip is wear loose, comfortable clothes. We don't want your clothes to be very tight because your body is growing. Tight clothes can also lead to water retention. So, loose, comfortable cotton wear that is a bit stretchy would be your best choice during pregnancy. You could also ask your doctor for compression stockings that will give a little bit of pressure to your feet to improve the amount of circulation that is there in your feet. Do not opt for the knee-high variety because it can lead to a lot of swelling on the upper part because the stockings is going to be a little tight. Instead, opt for the waist-high variety, which will ensure that your full feet is getting the compression and pressure, leading to lesser swelling in your feet. Finally, if you feel like your feet are swelling even after you've followed all this, or anytime you feel like your feet is swelling, ensure that you sit down with your legs elevated above your hip level. If possible, you can elevate it even above your heart level by lying down. Lie down on your left side. So when you elevate your feet above your heart or your hip level, all the water will drain back, excess fluid will drain back, leading to less swelling. Sleeping on your left side will also reduce the pressure that the uterus puts on the vena cava, which takes blood, to your lower part of the body. So this will also help take off the pressure and improve the amount of circulation that is there in your legs. I've given you a whole list of tips. Try each and every one and see which one works for you. You could keep mixing 2 or 3 per day and seeing, which combination works best for you. Don't forget to come back, comment, and let me know which tip worked for you. I would love to hear from you. If you found this video useful, don't forget to like, share it with another person who would benefit from watching this video, and hit the subscribe button to get much more informative videos like this. I will see you soon in another interesting topic. Till then, this is Saranya signing off with lots of hugs and strength to you. Take care.